Okay. Hello, everybody. My name is Stacy Wood. I'm the HHS Health and Human Services Public Information Officer. Thank you all for being here today. A couple of housekeeping items. We have a couple of different ways that the media are tuning in. They are tuning in via web through Zoom and a call-in line. So Zoe Mapofu will be over at that station moderating questions as they come in, and we will address those during the Q&A if they have not already been addressed during this media briefing. So we have American Sign Language translator here with us, Ashley Kurvalka, and we also have Regina Pente. We have simultaneous Spanish translation through Rocio Quintero and Luis Serapo. And to start out with, we are going to have a summary overview updates by all the reps here with us today, and then we will open it up to Q&A. At this point, we're going to have all of the people who are maybe speaking to you today to come up and say their name and spell it, and then we will begin with Fletch Tove, our Emergency Preparedness Coordinator in Public Health.
Jennifer Mullendor, Jennifer, Mullendor, Mullendore, and I'm the Interim Health Director for Buncombe County.
Dr. William Hathaway, Hathaway. I'm the Chief Medical Officer for the North Carolina Division of HCA Healthcare.
My name is Fletcher Tove. I am the Public Health Emergency Preparedness Coordinator. It's Fletcher Tove, Tove.
Suzanne Swanger, Associate Superintendent of Buncombe County Schools, SUSANNESWANGER.
Lisa Payne, School Nutrition Director for Buncombe County Schools, LISAPAYNE.
Tony Baldwin, Superintendent of Buncombe County Schools, TONYBALDWIN.
Taylor Jones, Emergency Services Director for Buncombe County, TAYLORJONES.
Shane Cassida, SHANECASSIDA, Assistant Superintendent, Asheville City Schools.
Ashley Michelle Thublin, Executive Director of Communications, Asheville City Schools, ASHLEYMICHELLETHUBLIN.
Bobby Short, Interim Superintendent, Asheville City Schools, BOBBIESHORT.
And I'm Stacy Wood, Health and Human Services Public Information Officer, STACEYWOOD. Before we get started, I would like to acknowledge the presence of our elected leaders who are with us here today, and I'm going to ask them to stand up and to introduce themselves quickly before we get started. We'll start with you, Commissioner.
Brownie Newman, Buncombe County Commission Chair.
Esther Van Homer, Mayor of Asheville.
Sheriff of Buncombe County.
Josh Harold, Town Manager, Town of Black Mountain.
Jasmine Beach Ferrara, Buncombe County Commission. Amanda Edwards, Buncombe County Commission.
Joe Belcher, Buncombe County Commission.
Jerry Dehan, Mayor of Woodville.
Al Root, Mayor of Weaverville.
Selena Coffey, Town Manager, Town of Weaverville.
Alex Carmichael, Town Administrator, Montreat.
Steve Kyburn, Clerk of Superior Court, Buncombe County.
Tyrell Pender, County Manager.
Captain Campbell.
Welcome, everyone, and good afternoon. Again, my name is Fletcher Tove. I am the Public Health Emergency Preparedness Coordinator. First off, thank you, everyone, for being here as partners and allies in our community response efforts, ensuring that we get accurate and beneficial information passed to our mountain community. Last Thursday, we declared a local state of emergency in Buncombe County in the face of the COVID-19 pandemic. Since then, we have made significant progress in our response efforts to include standing up our Emergency Operations Center and working in lockstep with the City of Asheville and City and Buncombe County school systems to prepare for the school closures mandated by Governor Cooper via executive order on Saturday. There will be some who will be confused or frustrated by these recent decisions and by decisions yet to come, and I want to put into perspective that these decisions are made to safeguard the health of our community, especially those most at risk. This is about protecting our most vulnerable. This is about our grandmothers and grandfathers, our mimas and papas, nuestras abuelitas y abuelos, a nashik babushka y diadushka. It's about our neighbor who is sick, our coworker who has asthma, and our friend who has diabetes. The mayor of Boston drew a great comparison yesterday. He reminded all of us that St. Patrick's Day is a celebration of our community overcoming hardship through social solidarity. That's what we're asking for from the families, communities, businesses, and visitors to Buncombe County. Social solidarity and shared sacrifice. Shared sacrifice to protect the most vulnerable and to take steps to effectively lessen the impacts of COVID-19 on our mountain home. Social distancing is a specific strategy proven by data to severely lessen the impact of high consequence pathogens. In the coming weeks, it will be a critical step in flattening the curve. When we talk about flattening the curve, we're talking about the impact of a surge of cases on our healthcare system's capacity. We use social distancing in order to slow the spread of the virus to prevent a huge spike in the number of people getting sick and needing medical attention all at once. If that happens, we, as a county, but also as a state and a nation, don't have enough hospital beds for everyone who would need them. So through our mitigating measures, we flatten out that spike over time so that it never overwhelms the capacity of our hospitals and healthcare systems. That's our goal. Again, thank you for being here as partners and allies as we work together during this unprecedented and rapidly evolving situation. With that, I turn it over to Dr. Tony Baldwin, Superintendent of Buncombe County Schools.
Thank you, Fletcher. To my left, I'm going to ask Ms. Lisa Payne to join me. She is the Director of Child Nutrition. And on my right, I'm going to ask Ms. Suzanne Swanger, who is our Associate Superintendent in charge of curriculum. This morning, our employees reported to work, the regular work day. There's an extensive amount of planning, discussion, preparation taking place as I speak. We had two significant projects of distribution that began early this morning and will continue on over the next several hours. The first is the distribution of food through our child nutrition program. I'm going to ask Mrs. Payne to give you details regarding that and how we made every effort and continue to make every effort to accommodate our students now in their homes. And then I'm going to talk about the second distribution, which is also important, and that is our distribution of laptop devices as we move as quickly as possible into a virtual learning platform for computers at home. So with that, I'm going to turn this over to Mrs. Payne to talk with you about the food distribution.
Thank you, Dr. Baldwin. I'm proud to stand in front of all of you today and tell you that this morning, Oakley Elementary, West Buncombe Elementary, Emma Elementary, Johnston Elementary, Pisgah Elementary, Owen High School, Hominy Valley, Black Mountain Primary, Weaverville Elementary, Estes Elementary, North Windy Ridge, and Woodfin Elementary, that we had 199 employees go to work and we're prepared to start feeding breakfast at 7:30 a.m. We had some of our community sites, we did have buses, our yellow buses, and our bus drivers are taking food to them. And we have Google Docs that are changing every few seconds that the principals are able to reach community. I have a call center at my office. I'll give that phone number, 828-255-5932. If you know of any area eligible children that are in need of food, ages basically birth to 18 years old, feel free to call that number and they will get added to that site. We are prepared to do whatever we need to do to guarantee that there is no child hungry or food insecure in Buncombe County that we serve. And we are very blessed to have the support of community partners and our Board of Education, Dr. Baldwin, of course, and all of you to make that happen.
Our curriculum team has been working for the last 2 weeks to prepare for an e-learning type of learning situation. We are very fortunate that we are a one-to-one district. That means we have one device for every student in Buncombe County schools. We have been training teachers for the last 2 to 3 years, but better implementing e-learning types of situations this school year. So teachers are in their classrooms today, just solidifying plans. I know many worked over the weekend. We have a wonderful website that will come live today that has resources for families, because families have questions. What does e-learning look like? How do I navigate the work in my home that happens in a school building? And we know that a face-to-face teacher in a school day can't be replaced by home learning, but it's important for students to continue learning. And we are working on getting those devices home this afternoon. And for families who may not be able to get to the school, we will have buses deliver those devices. They just need to call their school buildings and let the principal know, and we've got plans for that. Our virtual website will launch, as I mentioned, and with great resources. We also have take-home kits with paper materials and manipulatives for the younger learners for K through 3 students. In the meantime, parents can be relaxed in having school at home look like reading and writing. We can do that at any time while we're waiting on our virtual platform to go live. We will be very sensitive and very flexible with our families and our staff and continue communicating.
Good evening, afternoon, or about lunchtime, whatever time it is. We are grateful to be here today to share with you the kinds of plans we have in place to serve our children in this trying time. And we want to thank the community for stepping up to the plate to help us serve our children. Joining me will be Shane Cassida, our Assistant Superintendent of Auxiliary Services, to talk about our food plan, and Ashley Michelle Dublin, our PR Director, to also tell you some of the communications that we have in place for our parents. Our 2 main goals right now is, number 1, to feed our children, and number 2, to educate them to continue with at-home learning as best we can. We have sent home packets with our K-5 elementary students. Those went home Friday. Those will be ready for use today. We have given the start date officially as tomorrow. We have sent home devices with our secondaries. That would be our 6th through 12th grades. Those went home Friday, and we have lessons in Canvas, and they are ready to begin that work also. We are distributing laptops to 3-5 in the coming days. In fact, our parents are asked to come in beginning today to pick those up. So Shane and Ashley Michelle will share further details with you.
I'll go through the feeding details that we have from our auxiliary department. Beginning tomorrow at 11:30 to 1, we will have 4 delivery sites, which will serve approximately 500 meals on the first day, 500 lunches, and then they'll also have 500 breakfasts that'll be there as well. Those 4 delivery sites will be Pisgah View, Hillcrest, Klondike, and Livingston. And then we will have a drive-through site at Isaac Dixon Elementary School. That drive-through site will have approximately 200 lunches with 200 bagged breakfasts for the next morning, and that'll be from 1 to 4 p.m. So essentially, we'll have food services available 11:30 to 4, and that'll be every day for the foreseeable 2 weeks that we have, and then however much longer this may go, we'll continue to work. If families or students need to be not able to access food or not able to access those sites, we do have a hotline number for them to call, 350-6000, and that will set them in contact with our individuals that will be able to take down their name, their address, and then we'll begin to expand sites and definitely be able to get food to those students. We're also going to put our social workers, they will be at each of those delivery sites and our drive-through site. So if families have additional needs, our social workers will be there to be able to support them and connect them with some other community resources. We're working with our volunteer partners as well, MANA and YMCA. Those will also be available on site, plus there's others in the works today to provide additional resources for our students. We also will probably be able to staff most of those sites with some type of technology support. We're going to have a technology support individual there to support families as they're able to work with these devices and connectivity issues. We want to make sure that we're supporting them through that process as well. The hotline will also have some additional extensions if families have issues with academic support. That will be 6175 is the extension that they will connect with. If they have technology issues that they want to speak with someone, that'll be 6181. And then if they have unique student service needs with a nurse, dietary issues, social work or counseling or mental health, that'll be 6133.
So as Dr. Short and Mr. Cassidy mentioned, Asheville City Schools has been preparing for COVID-19 for several weeks now, and we essentially, as Dr. Short shared, we are flying the plane as we are building it. So things could change potentially, and our goal is to keep our families as informed as possible. The best way to receive information about Asheville City Schools and the proactive steps we are taking throughout the coronavirus is to visit our website, ashevilleCitySchools.net/coronavirus, or check out our social media platforms, specifically Facebook and Twitter. Additionally, for specifically our Latinx community, on our website itself, the entire thing can be translated into Spanish or Ukrainian. So just families, please bear with us as we are trying to communicate to the best of our ability and keep you informed throughout this process.
Good afternoon. I'm Jennifer Mullendor, the Interim Health Director for Buncombe County. Today, Macon County Public Health announced a presumptive positive case of COVID-19 in a person who visited Buncombe County last week. This is the first known presumptive positive case of COVID-19 associated with Buncombe County. The individual visited Asheville March 10th through 13th, at which time they had symptoms of COVID-19. They were tested by Buncombe County communicable disease staff and immediately traveled on to Macon County for isolation. The individual has been cooperative with all public health requests. As we speak, Buncombe County public health staff are conducting an investigation into this individual's activities during their time in our county. More information will be provided as we identify potential close contacts. Buncombe County Health and Human Services will not release further details about the individual to protect their identity. Today represents an unprecedented time in the history of Buncombe County and our nation. At this time and over the coming days and weeks, government officials will have to make difficult decisions to protect the overall health of our community. Today, we will begin to implement recommendations that increase social distancing in our community. The effects of these measures on our entire community are top of mind, and we are working diligently to ensure that their needs are met. As a resident of Buncombe County, and specifically Asheville, as a parent and as a physician, I have been heartened by the response and support that we have seen so far from our local healthcare providers, health systems, schools, human service agencies, and many other community partners. By working together, we can make a difference, but we must change our behaviors. Please take care of yourselves, your families, your friends, your neighbors, and support our local businesses, but remember to do so in a responsible manner and follow recommendations from the Centers for Disease Control and local health officials. It is important that our community remain calm, stay informed, and be prepared for the spread of this illness. It is critical that everyone follow the guidance to stay home when you are sick. Additionally, everyone needs to wash their hands frequently and cover their coughs and sneezes. High-risk individuals, those over 65 years of age, those with underlying health conditions and weakened immune systems should stay at home to decrease their chance of being infected. If you or a family member have fever and cough or difficulty breathing, call your healthcare provider or an urgent care if you do not have a healthcare provider. Please do not show up at your healthcare provider's office or at the urgent care without calling first. Do not go to the emergency room. Emergency rooms need to be able to serve the most critically ill. If you are having a medical emergency, call 911 and tell them your symptoms. If you do not have a healthcare provider or cannot afford to be seen at an urgent care, call our Buncombe County Communicable Disease staff at 828-250-5109 to speak with one of our nurses. If someone doesn't answer, leave a message and know that they will get back to you as soon as possible. People with symptoms of COVID-19 should not come to our health department. At this time, I'll turn it over to Dr. William Hathaway from Mission Health.
Thank you, Dr. Mullendore. I appreciate that, and I echo all your recommendations to the community about how to individually approach this illness so that we can, as Fletcher Tove said so eloquently, flatten the curve and not overwhelm the healthcare system. We have received lots of requests and queries about whether we have had any confirmed or presumptive positive cases in our facilities. And speaking on behalf of the entire region where we provide services, we have had none to date. I fully expect that to change. The case that became positive in Macon County was not a surprise to us. We knew it was going to happen, and so I don't want the community to be alarmed or surprised when those announcements come. It's our job to be prepared to handle these. Along those lines, I'd like to emphasize a few things. Most importantly, we have restricted visitation in all of our facilities. The visitation at this point in time involves screening at the front doors, and as cases become more prevalent and identified in our community, those screenings and restrictions will increase. That is for the patient's protection, it's for our health care workers' protection so that we can continue to provide the needed services that our patients will continue to demand, both for COVID-19 and for other illnesses. So please bear with us, and we ask that you severely self-restrict your visitation as much as you possibly can, and certainly do not come to the hospital if you have any respiratory symptoms whatsoever. As Dr. Mullendore emphasized, we ask that everybody reach out to their primary care providers when they have symptoms or signs or questions about the illness. We have, in addition to that, a virtual platform by which we can take some questions. It's available at the missionhealth.org website. under virtual clinic. So missionhealth.org/virtual clinic. We are, of course, gearing up rapidly, as are many other facilities in the community, to offer more widespread availability of testing. We understand the public's concern about this, and we believe that in order to help stem the tide of this local impact of the pandemic, that we have those facilities available. We have more testing available. We are going to announce more broadly in the next few days where and how that testing can be achieved. We have testing now, and if you go through your healthcare providers, they can get you where you need to go to get that testing. And then, of course, most importantly, we serve as the bastion for those who get sick, and we are actively planning and working diligently, as we have been for the last number of months, both in our own facilities and in conjunction with other healthcare systems in the region, to make sure that we have adequate bed space and resources to take care of the patients when they get sick.
In light of these recent developments and in an abundance of caution, Buncombe County is strongly encouraging the limitation of any large public gatherings and asking restaurants and bars to proactively limit services to takeout and delivery only. This is not a request that we take lightly. We are acutely aware of the impacts and secondary impacts decisions like these have on our local independent businesses and local economy. But in light of these unprecedented events, it is in our community's best interest to follow guidance from the CDC, State Department of Health and Human Services, and our local health officials to limit the congregation of people. Additionally, local businesses need to start planning now in anticipation of expanded and more directive mitigating measures in the near future. This is a rapidly changing situation, and we may very well be in a different place by the end of the week. This morning, we were on a call with Asheville Independent Restaurants, the Chamber of Commerce, and the Tourism Development Authority to coordinate these plans to make sure we're moving together in the same direction in this impactful time for our community. And we've been impressed by the willingness of most businesses to proactively take steps to mitigate community congregations. And we've seen many business leaders limit hours, reduce capacity, and even shut down. And we're asking everyone to continue assisting us. This can mean the difference between life and death for some of our most vulnerable family, friends, and neighbors. We know tomorrow is St. Patrick's Day, and again, we're asking the businesses, citizens, and visitors to Buncombe County to avoid crowds, avoid congregation, and avoid exposure. Some businesses and child care facilities must make the difficult decision whether to stay open, limit hours of operations, or close altogether. We recommend that these businesses, nonprofits, organizations, and facilities that do choose to stay open follow the recommendations of the North Carolina Department of Health and Human Services and the Center for Disease Control on best practices for how to limit risk of exposure. Thank you. And with that, we will open it up for questions from the media.
Yes, as I mentioned, repeat the question, I know, as soon as I started. So she's asking for additional details, essentially, about this person's whereabouts during their visit to Buncombe County. As I mentioned before, we are actively trying to compose a timeline exactly when this individual was at certain locations. And we have to remember, COVID-19 appears to be mainly spread by droplets. And so when we talk about who is at risk, we're talking about people who are close contacts. And the definition of close contact is within 6 feet for 10 minutes or longer. And so again, using that information along with the timeline that we are actively creating with the individual, we will better be able to inform those who are identified as being at risk. And so once that information becomes available, we'll share it. I haven't spoken to them. So the question was, yesterday, local pharmacy, Sona Pharmacy, held a drive-through testing site, testing event for COVID-19. I haven't spoken to them directly. Has any?
So prior to their opening, we had close coordination between them and our emergency operations center to make sure they were prepared for the situation, anticipating traffic flow issues, congestion in the parking lot, and other safety features. So we're trying to coordinate those as we see public testing sites open in the community. We're also pushing really hard to, later this week, open Buncombe County run community testing sites, and we'll have more information on that later.
How many people have been tested so far in Buncombe County?
So as of 10:30 today, our agency, Buncombe County Communicable Disease staff, have tested 10 individuals. We have received 70 reports of testing by local healthcare providers. So per state guidance, when providers conduct testing at their clinics, they are to send us a CDC form so that we are aware of the number of testing. So adding that up, it would be 80 individuals have been tested as of 10:30 this morning.
What does this test show you? Oh, sorry. Okay. What does this test show you? Someone who has the disease, someone who's a carrier to the disease, someone who could possibly spread it to someone else. What does the test show you?
So the test is for people who have symptoms consistent with COVID-19. So the test is determined if they have COVID-19.
Sorry, I'm just reading from the list. How many tests does Buncombe County have at this time? Like, how many do you have available?
So in our clinic, we have probably about 20 to 25 test kits, supplies for testing. Please.
From our perspective, this is a rapidly changing situation. We have many, many more test kits available to sample patients. I don't know the exact number, but I do not believe that will be a limitation in the near future. We are actively pursuing a variety of different measures to increase the testing. We're utilizing not only the state lab now, but we're utilizing commercial labs, which greatly expand our capability and capacity. It doesn't do much for the turnaround time at this point in time. It's still a 3 to 4 day turnaround time, which is very troubling for us. We'd like it much more rapid than that. There are new platforms which are becoming available through a host of different companies which are being rapidly expedited through the FDA. And if and when we think those are reasonable for us to bring them on, we will bring them on to our many providers in the community.
You recommended bars and restaurants and such not just switch to takeout, delivery, and all that. Why not mandate it as we've seen in other states and other cities?
So, we're talking about this is a community effort. So far, we've had really great buy-in from the community. A lot of business leaders being proactive, taking those steps on their own. We are having that discussion, but right now we're asking for buy-in. It's a big ask, but we're in this together. We're asking them to be proactive, follow the CDC guidance, follow the North Carolina Department of Health and Human Services guidance, and our guidance as Buncombe County Public Health. Again, as we all know by now, this is changing day to day, so that guidance may change by the end of the week. But right now, we're not mandating; we're just asking for cooperation to protect our most vulnerable.
Fletcher, is there any discussion with local hoteliers about asking them to limit visitation?
Yes, I mean that ask is across the board for all businesses and restaurants and public venues, entertainment spots for the county. So it's an all-inclusive ask. And again, we're acutely aware of the impacts and secondary impacts that may have on the local economy.
So the CDC, they're recommending that the cancellation of events with 50 or more people last for at least 8 weeks now. Do we believe that canceling school for 2 weeks is going to be enough here?
So I think that if you read the governor's executive order, it is quite possible that guidance will change. When it comes to school closure, What I would say is there's still a lot about COVID-19 we do not know. And one of the things we do not know about it is how children are involved in the spread of the infection. And so, unfortunately, that's something we're going to have to learn as we're experiencing this outbreak. I would say my concern about school closure is where are the children going when school is closed? And so again, just like we've been saying up here, children need to be at home where we're keeping our social distance, right? And as we see what happens, as the state sees how this plays out, as the CDC sees how this plays out, the recommendations may change regarding school closure.
And then one follow-up for the school systems. So we've gotten a lot of messages, specifically from bus drivers who are worried about their jobs, as well as substitute teachers, because they rely on that sometimes as like their primary form of an income. Can you all touch on it all, specifically bus drivers and substitute teachers, and if they will be getting paid through this?
I can tell you that we're making every effort to ensure that all of our employees remain paid. That's the challenge as we close down our schools. We have over 4,000 employees. All of our categories of employees are at work today. And again, we're trying to be as creative as possible. Certain categories of employees may be in roles that they're not necessarily accustomed to, but are important in order to provide the functions and stability that we need to provide for our kids out in the homes.
We are using our bus drivers to help deliver our meals. And we also just left a meeting with our administrators, with our principals, in outlining job duties for all of our staff members. We are encouraging all of our staff members to do their work remotely, if at all possible. If not possible, then we will have our buildings open. There will be some modified schedules, and all employees will have an opportunity to do work.
This question is from Mackenzie Wicker. Oh, okay. Okay. Hello. This question is from Mackenzie Wicker with Asheville Citizen Times. What will the county be doing to help those in the community who find themselves out of work as businesses temporarily close due to COVID-19? Will the emergency response include actions to prevent folks from being evicted?
So we've been talking about the secondary impacts of COVID-19, particularly on our local businesses and particularly employees who might be hourly wage workers. As part of the Emergency Operations Center, we are opening up a working group to specifically address that issue, led by our economic services team, to connect those individuals to resources through local partners, through state and federal resources, and make sure we can connect them to any possible resource we can.
Are there any more questions from users who are on the Zoom app? Okay, we're not seeing any come through. If you can continue to send your questions to hhspio@buncombecounty.org. Throughout the day, we will compile them and collate a response. Hopefully that will address the majority of your questions. We will plan daily media updates at this point, and will be as communicative as possible throughout this, again, evolving situation. At this point, if there are no more questions from the media, okay, thank you all for your partnership in getting the word out.